Kalo Falahiatu, welcome to tonight's bulletin of BCN News. Leading our news tonight, the Director General of the Ministry of Social Services, Mrs. Gayleen Tasmania, is asking the public to have confidence in their team, which has been at the forefront of Niue's COVID response. Mrs. Tasmania, along with the Chief of Police, Tim Wilson, and the Director of Health, Dr. Eddie Akawala, fronted a Q&A on Radio Sunshine yesterday. Here's more on that story. Mrs. Tasmania says that this is the time that we must trust in each other and work together through what has been the most challenging year. She wants to assure the public that no decision is made without first protecting the safety of frontline staff. Since the option of home quarantine was approved by Cabinet last month, there has been a great deal of negative public reaction to this decision.
We have heard the public the public voice and their opinions, and that's why we have produced these Q&As, and they were translated. We've given them to all the village councils to start distributing to their village members, but also we have been asked to make sure that every household gets a copy, whether it's in English or Whangauniwe, but that everyone, all the questions that they had, which we saw were very similar, but we have answered them in all of the Q&As. And if there's anything that people don't still are not sure about because we haven't responded to them in the Q&As, then we're happy to take on those questions. But since we put out the Q&As, we've never had any questions which aren't already answered in the Q&As. So as we were so busy trying to work on the logistics and making sure that passengers knew what they had to do, get the testing done on time, and have a look at the sites and all these other things, we didn't quite get to the public prior to that. But ever since, for the last 8 to 9 months, I think it's important that people realize the information that we have used to make decisions ever since has been based on technical, official information that we get from Ministry of Health in New Zealand, the WHO, SPC, and others. So although people probably don't realize all of the work that's been going on in the background, but for the last 8 to 9 months, we have continued on a weekly, almost daily basis now, keeping up to date with information that comes out from New Zealand, especially as they've had several community cases. So we have a look at those. What is the impact? What are we going to change? And if you've noticed, we haven't actually changed much. This is the first time, or in a while, that we've had to change our strategy for home quarantine, introducing it as we look to step towards quarantine-free travel.
Mrs. Tasmania says that the government's COVID committee has been working on COVID response for the past 9 months and have always based their decisions on official health information.
Taking baby steps is going to help the team adjust to different protocols, different scenarios, but we do bear in mind that there is public outcry, and most of it is due to not having the same information that we as a technical team have. So I'm glad that Rhonda is our new communications officer. We expect to have a bit more public awareness, that information transfer, information that we have is able to be translated in a more timely manner. We provide safety for our frontliners, and in turn, the public at large is also kept safe. So I think that's been at the forefront of all of these decisions. But we've also got to progress. We can't we can't keep doing the quarantine, as we know that COVID-19 is here to stay for a while yet, and before the vaccine comes through, we've got to look towards getting our people more in line to kind of not ease, but to be more trusting in the information that we have, and that we are working with public safety in mind.
In a press statement from the Education Department yesterday afternoon, the department has denied any wrongdoing on the part of a teacher of Niue High School who told a 13-year-old student to walk home in the middle of the school day. The 2-page statement only had 1 paragraph responding to the issue of bullying and concerns from the community about this incident, which happened 2 weeks ago and was on BCN News 2 days ago. Part of the statement reads, "We do not believe there is a school culture of bullying as stated by a parent on national television. The schools have school rules that students and teachers adhere to, so when students are asked to comply with these school rules, then it is misleading to state that this is bullying. Parents and caregivers do refrain from confronting teachers outside the school. See the principal to address concerns, and this includes voicing your frustrations on social media." The press statement from the Education Department was titled "Building Bridges Between the Schools and the Community." However, it clearly does not mention the school or the department taking responsibility for the emotional harm caused to the student and his family. BCN News is awaiting further information from the Education Department on the status of the school committee or the PTA, which apparently has not been active for nearly 10 years. And also information to questions about the students of primary school suspended for consuming alcohol on school grounds. A total of 4 applications were received for home quarantine leading up to Monday's flight. However, only 2 were approved. I asked Dr. Eddie Akawala, the Director of Health, what the risks are for Niue with the option of home quarantine, whether this is a safe option for Niue.
The risk of spreading the coronavirus here is very, very extremely low. Because that's why we asked for the 2 tests. In New Zealand before they board the flight. So those 2 tests are strong evidence that they are not carrying the virus with them. And also before they depart, there is an exit screening at the Auckland Hospital before they board the flight. There will be some health staff there to do the temperature and all those vitals to check. If they fail those, they won't be allowed to board the flight. So there are 3 screenings, 2 COVID tests before they come to check in, and before they check in, they also have an exit screening. So, if when these passengers comes to Niue, they also screened at the airport by our health staff. So the chance from health perspective, these people coming to Niue, they don't have the virus. Extremely, extremely low.
According to Gayleen Tasmania, the Director General of the Ministry, there are strict criteria and preconditions associated with home quarantine based on risk assessment principles, with public safety at the core of those assessments. She said that one of the considerations of home quarantine is the mental health and the well-being of those in quarantine.
Mental health is quite a big issue. And so by giving an option, it's not for everybody. It's only for those people who are going to go that extra mile to get an opportunity to stay at home. But while they are at home, they can do other productive things at home as opposed to being basically incarcerated, is what, because most people just don't want to come out. They feel that they've got to stay indoors, and that doesn't do their mental health any benefits. It's good that if you can do more productive work at home at minimal risk to the general public, then I think COVID aside, you want to maintain that good health and well-being of our people.
The officials say that it is up to Cabinet to decide whether to extend the option of home quarantine to the December flights, but they are hoping for more public understanding of some of the benefits of home quarantine. And staying with health, the Director of Health, Dr. Akawala, says that they are struggling to send their referral patients to New Zealand because of the lack of vouchers for the quarantine facilities there. 7 patients were referred to New Zealand on Monday but didn't get their vouchers until Sunday night.
That is a big problem, Esther. We struggle to get vouchers for those people so they can go and to quarantine in New Zealand without paying in a single cent. But because of the COVID travel restrictions, no specialist has come to Niue during this year, the whole of this year. So we start to send our high-risk patients to New Zealand, but our problem is the full quarantine over there. The facilities are all full up. And to secure a voucher before they depart, because Air New Zealand won't uplift them if they don't have a voucher.
However, this is not the only issue for the Niue Health Department. Dr. Akawala says they are also very concerned when the referred patients arrive into New Zealand. They are being quarantined in facilities along with passengers from other countries with large numbers of community cases. Patients from Niue risk exposure to the virus at these quarantine facilities because of the passengers flying in from countries with high number of cases like the USA, Asia and European countries.
And another problem that we found out when we do the talk with the New Zealand counterpart is that Niue is COVID-free, but when our patients arrive in New Zealand, they will go to facilities where people who come from infected countries, they will be staying together, depending on the availability of the facility. So that is another hurdle. But on the last flight this week, we struggled to get vouchers for our 7 patients. Even on the last night, on the Sunday night before the flight out on Monday, we got the last voucher. And thanks to the help of our counterparts in New Zealand and also the New Zealand High Commissioner here and their staff, they also assist us by lobbying to get all those vouchers. It's a hell of a problem and our patients are suffering. And so is the families.
BCN News understands that there are no specific accommodation or quarantine facility dedicated for passengers from COVID-free Pacific Island countries like Niue. And that's our bulletin of BCN News for tonight. You have a lovely weekend. We'll be back with you next week. Until then, have a lovely evening. Good night.